Here we're going to talk about the cardiovascular system, integrated with almost all of the other systems of the body. This is the system that pumps blood around our body, delivering oxygen, nutrients, hormones to where they're needed. So there are 5 key functions that we're going to talk about. 1, the primary one, transport of oxygen, nutrients and hormones. And this is transported via the pump, the heart, and through that network of veins, arteries and capillaries around the body, delivering oxygen, nutrients and hormones to wherever they're needed in the body. But also it returns deoxygenated blood and waste products back to the heart, and where they're then eliminated or where oxygen is reabsorbed via the lungs. So a key integrator with the respiratory system. Removal, as we mentioned, the removal of waste products. So as the system goes around the body, it collects waste products and carbon dioxide for removal from the body. It also has a protective function. It protects us from infection. Blood contains a number of white blood cells, which are transported around the body and help fight off against foreign agents and fight infection, and also to deliver those white blood cells where there's damage, for example. Thermoregulation. So we talked about this briefly in the skin module earlier on. So the pumping of the blood around the body helps to keep it at the right temperature. But also when we are too hot, for example, those capillaries nearest the skin vasodilate, releasing heat from the body to allow us to cool down, that red flushing of the skin. But also when we're really cold, that vasoconstriction of those capillaries, veins nearer the body, nearer the surface of the body, so in the extremities near the skin, and pumping that blood, keeping it towards the organs to help us survive and to keep them warm. But it also plays a role, along with the lymphatic system, for example, on maintaining fluid levels of the body. It works closely with the lymphatic, nervous and endocrine systems to maintain fluid balance in the body. So now we're going to go through the anatomy of the cardiovascular system. And we're going to start with the pump. That contracting, relaxing, that beat of the heart that pumps the blood around the body. Now, it contracts and relaxes, so the heart is a muscle. It is made up of muscle tissue, cardiac muscle tissue, and we talked about cardiac muscle in the muscle theory module. It's different from skeletal muscle. It's striated in appearance and it's controlled involuntarily, automatically. The myocardium is the term that we use for this muscle tissue of the heart. It is found in the walls and the histological foundation. Now, how does it beat and contract? This sinoatrial node is a group of cells in the heart which can be described as the heart's natural pacemaker. And this group of cells sends electrical impulses through the heart, causing it to contract. This creates the pumping, the contraction, and then the relaxation phase of the heart. Now within the heart itself, it's made up of a number of chambers which are used for storing and moving the blood in and out of the heart. Here we have the right atrium. And in this atrium, deoxygenated blood, which is brought to the heart via the veins, superior vena cava on the upper side, and the inferior vena cava on the lower side. They bring the deoxygenated blood and it flows into this chamber called the right atrium. It receives and holds that blood until the contraction of the heart pushes the blood through a valve called the tricuspid valve. And this valve prevents backward flow of blood. So as it contracts, pushes through the tricuspid valve, it then lands into the right ventricle. The valve prevents it flowing back into the right atrium so that the blood is always moving in the right direction. The right ventricle receives the deoxygenated blood from the right atrium, and when it's full and when it starts to contract, it pushes the blood out of the right ventricle and towards the pulmonary artery to be brought to the lungs for reoxygenation. On the left side, we have the left atrium, again for collecting blood, but this time it collects the oxygenated blood that is brought back to the heart following respiration and reoxygenation in the lungs. Similar to the right side, it has a valve to stop that backwards return, called a bicuspid valve or the mitral valve. And as the blood pushes forward on contraction from the left atrium, it moves into the left ventricle, where the blood is stored until it's pumped out of the heart, ready to be circulated around the body. It is pumped out of the left ventricle and into the aorta, where it then flows to where it's needed in the body. As we look at this second image, you can see those chambers more clearly. So here, that right atrium, remember, serviced by deoxygenated blood coming from the superior vena cava or the inferior vena cava, collecting, coming through that tricuspid valve and into the right ventricle, from which the pulmonary artery will bring it to the lungs for oxygenation. On the other side, as the blood is oxygenated and returns from the lungs, it collects into this chamber, the left atrium. It then comes through that bicuspid valve and into the left ventricle, from which it is pumped forward through the aorta, ready to be circulated around the body. So let's look at the anatomy of blood, the liquid that's pumped around the body, which delivers and contains the oxygen and nutrients, but is also what picks up the waste products that we've talked about, the waste products that organs excrete. For example, carbon dioxide, which it then brings to the lungs. So there's a lot of blood in our body, 5 to 6 litres in a man and 4 to 5 litres in a woman, and it makes up about 8% of our body weight. It consists of plasma, platelets, red blood cells and white blood cells. Plasma is the liquid element. This makes up about 55% of the blood, and it's what gives it its liquid quality. The plasma carries the other cells and allows for that pumping transport through the body. It also carries nutrients, enzymes, wastes, hormones and gases in the blood. We then have red blood cells, and these contain a protein pigment called hemoglobin, and this is what carries the oxygen and is also what gives blood its distinctive red colour. They're donut-shaped cells, and unusual for cells, they don't have a nucleus. They also cannot reproduce. But this donut shape gives them the ability to move through even the smallest veins and capillaries, which is really useful for the exchanges that take place across membranes. Red blood cells are formed in the bone marrow, and they're produced as and when needed by the body. The kidneys help to regulate their production when oxygen levels are low in the blood, so integrates with the urinary system too. Now, white blood cells. This makes up about 4% of the constituency of blood. And there are a number of different types, for example, lymphocytes and neutrophils. And they provide the body with a powerful defense mechanism. They fight, digest infection and foreign agents, pathogens, to help as part of our immune system. They are formed mostly in the bone marrow, but some are made in the spleen and the thymus gland, for example. Then we have platelets. These are the smallest element in the blood. Their lifespan is only around 5 to 9 days, and they prevent blood loss. They have a sticky texture, and they collect at injury sites as part of the clotting process. Platelets are also formed in the bone marrow. So we've talked about the pump, we've talked about the liquid. Now let's talk about the delivery network. And this is where the veins, arteries and capillaries come in, as these are the pathways, the tubes through which the blood will flow around the body. Now the arteries, they carry blood away from the heart. They carry that oxygen-rich blood. And they consist of a muscular tube with an inner lining of smooth muscle. Their smaller branches are called arterioles. And the coronary artery supplies oxygen to the myocardium, so the heart itself needs oxygen to pump. Veins are similar, again muscular tubes and lined by smooth muscle. They carry blood, deoxygenated blood, towards the heart. Again, they're further on the journey and they have this valve system to prevent the flow of blood backwards, as we don't want the deoxygenated blood moving back towards organs. We want it pumping forwards towards the heart where it can be reoxygenated. The smaller branches of veins are called venules. Capillaries are the smallest of blood vessels, and they serve as the connection between the arterial and venal system. They allow nutrients, oxygen and fluids to pass into the tissue and carbon dioxide and waste materials to pass out. So again, those capillaries are key to that exchange of various things via the membranous outer. Now we're going to talk about two types of circulation in the cardiovascular system. The first being pulmonary circulation, and this describes the process of deoxygenated blood leaving the heart, flowing to the lungs where it is reoxygenated before returning to the heart. From the heart, that oxygenated blood is then pumped around the body, and that leads us to the second type of circulation that we'll talk about, systemic circulation. So let's look at the pathway of the blood through this pulmonary circulation. Blood deoxygenated returned to the heart via the veins, the inferior vena cava or the superior vena cava, into the right side of the heart. It enters the right atrium that we talked about on the heart page. It collects in the right atrium and then it flows through the tricuspid valve into the right ventricle. And these valves are important in ensuring that the blood doesn't flow backwards. It helps to keep it moving forwards in a one-way system. As it moves through the tricuspid valve, it enters the right ventricle. And once the right ventricle is full, it contracts, forcing the blood into the pulmonary artery, which pushes it into the right and the left lung. Now, within the lung, we have this exchange of gases taking place. And we'll talk more about that in the respiratory module. But that deoxygenated blood comes through the lungs and the capillaries come right down to the alveoli, where the CO2 in that deoxygenated blood gets exchanged with fresh O2 that has been inhaled, or oxygen. And the O2 replenishes into the blood. So that oxygen-rich blood now makes its way back towards the heart. It enters the heart on the left side into the left atrium. And when this chamber contracts, the blood flows through the mitral or bicuspid valve into the left ventricle. And it is from here that the blood is then pushed out of the aorta, ready to be circulated around the body as part of systemic circulation. So what does systemic circulation look like? I like this illustration. It's obviously very simple and we're just using labels for the various organs of the body. But at a high level, it gives you a good view as to where the blood leaves the heart, where it gets delivered to, and how it comes back to the heart. Up here, the top part of this diagram describes what we've just talked about, the pulmonary circulation. That entering the blood entering the right atrium, moving into the right ventricle, into the lungs for oxygenation, and back into the left atrium, and into the left ventricle. Now, the aorta, it leaves the heart. The red here identifies the arteries, so carrying oxygenated blood to the various parts of the body. Blue being the veins. Once the oxygen is taken, it is then exchanged with any waste products and that deoxygenated blood returns. It's just an interesting little visual here showing the percentages, where the blood goes to and how it flows. So oxygenated blood out from the left side of the heart, delivered back into the right side via the veins. So let's talk about blood pressure. So blood pressure relates to the pressure within the cardiovascular system, where the blood pushes against the arterial walls. So it is about that pressure exerted against the arterial walls. Now, there are two measures, because remember, when the heart beats, we have the contraction phase, which is that push, and that is described as a systole. And this is where the blood pressure is greatest, and it's called the systolic blood pressure. And then in the relaxation phase, a diastole, this is where the pressure is lowest, and this is described as the diastolic blood pressure. And this is why blood pressure measurements are always given in two figures. The first being the greatest, the systolic blood pressure, where the heart contracts, and the second being the lower, the diastolic blood pressure, the relaxation phase. Blood pressure is measured in millimeters of mercury, which is represented as mmHg. Now, normal, high blood pressure and low blood pressure, described as hypertension, high blood pressure, or hypo, low blood pressure. Normal blood pressure is anything within the range of 90/60 to 140/90, with low being defined as less than 90/60 and hyper or high blood pressure being greater than 140/90. Low blood pressure is not regarded as a health concern, but it's often indicative of other conditions, so may go hand in hand with other pathologies that your client presents with. It's most common in those who are young, female, of slight build, fit, or strictly vegan. High blood pressure, on the other hand, especially chronic hypertension, where it's unmanaged, results in a constant strain and battering of those artery walls due to the high levels of pressure against them. And this is associated with an increased risk of coronary heart disease, stroke, kidney dysfunction, and even forms of dementia. High blood pressure often accompanied by arteriosclerosis and arteriosclerosis, a hardening or thickening of the artery walls, and can be very dangerous. So you may have clients who present with hypertension or high blood pressure. And what we need to understand is whether it's managed. Are they under medical care? Are they taking medication? And is it under control? If it is, we can absolutely work with these clients. But if their high blood pressure is unmanaged, then we need GP approval to work with that client. High blood pressure has many risk factors, and a wide range of lifestyle factors can increase the risk of high blood pressure. Exercise levels, weight levels, stress, nutrition, smoking, even excessive sweating can impact on our blood pressure. So simple lifestyle changes can help decrease blood pressure and decrease the risk of suffering from high blood pressure. So your clients, along with taking medication, may be taking lifestyle changes to help support in that process. So as well as screening your clients, it is good to understand what they're doing in terms of lifestyle to help manage the condition. So here are some of the common cardiovascular pathologies that your clients may have a history of or present with when they come to see you. Heart attack. So you will learn on your first aid course, which you must do before being a qualified therapist, how to, one, identify someone who may be having a heart attack and what to do in this situation. So we will not cover that here. But someone may present to you who's had a heart attack in the past. Recognition points: chest pain, shortness of breath, weakness, an overwhelming feeling of anxiety. Massage is contraindicated for 3 months following a heart attack, and seek medical advice before restarting treatment. Angina, symptomized by cramp-like pains in the chest, which are often made worse by exercise or stress. It's important that we don't stress our clients, so modifying pressure and a focus on relaxation is important. We can do good work with clients who suffer from angina, but we don't want to take their breath away and we don't want to over-challenge them. So always work in a good pressure window, which allows them to be able to breathe and remain relaxed throughout. If your client presents with coronary heart disease, this can lead to things like heart attack, angina, and even heart failure are symptoms. Every client is different and they'll be at different stages of this disease, so please seek medical advice from their GP before treating them. High blood pressure, we talked about earlier, often known as the silent killer. So if left unmanaged can lead to serious illnesses like heart attacks, kidney disease and stroke. So the key thing to establish here if your client suffers from high blood pressure is it managed? Are they on medication? And are their blood pressure readings normal at the moment? So if it's managed, we can treat these clients. As with any condition, if it's unmanaged, then we're referring them to their GP. Deep abdominal massage is contraindicated for these clients. Low blood pressure. As we said, not a great impact here, so it allows us to keep working with these clients, but just take care when your client is getting off the bed, as sometimes people with low blood pressure can suffer with dizziness, fainting, blurred vision, nausea. Find that sometimes clients with low blood pressure, if they get off the bed quickly, can feel very dizzy. I will often tell clients with low blood pressure to push themselves up to a seated position and to remain seated for 2 or 3 minutes until they feel the dizziness subside before standing up. Arteriosclerosis, so a thickening and hardening of the artery wall. Symptoms can include angina, chest pain, shortness of breath, weakness, confusion. Seek medical permission before treating a client with this condition. So DVT, or deep vein thrombosis, is a very serious condition. And this is where a blood clot, forms in the veins of the leg or calf. It would present with localized pain, swelling and tenderness in the leg or calf, which could also be symptoms that clients could come to you with. But it would also be red and warm in that very specific area of pain, where if it's a DVT, the clot would be present. DVTs often form where people have been lying down post-surgery, for example, post-stroke, post-childbirth, or after long flights or massive physical exertions. So it's really important with our clients with calf pain that we're also screening in terms of what has happened in the lead up to this pain or event. So if this calf pain presents with that redness and warmth in a very specific area of the calf or leg, then please refer your client for immediate medical attention. So please send them to A&E. If your client has a history of DVT, then massage is contraindicated for 6 months following the diagnosis and will also need medical approval that the clot has dispersed. Varicose veins, and these are formed. They're dark blue and bulging and formed where the vein walls have broken down and weakened, lost their elasticity. They're usually found in the leg and can be symptomized by heaviness or throbbing in the leg, and sometimes accompanied by swelling in the feet and ankles. So varicose veins are a local contraindication, and clients with varicose veins often find that massage helps with that feeling of heaviness in the legs and sometimes with the swelling in the ankles and feet. But the varicose veins themselves, we need to avoid applying pressure over them. They are a local contraindication. So phlebitis. This is where itis, inflammation of the vein wall, and this would present as painful hard lumps underneath the skin and a redness of the overlying skin. If your client has been diagnosed with phlebitis, find out where it is, get them to show it to you, and again treat this as a local contraindication. Hemophilia. So this is a reduced ability of the blood to clot. And so massage is completely contraindicated for a client who suffers from hemophilia. Anemia. This is symptomized by fatigue, weakness, pale skin, a shortness of breath and dizziness. There's no impact to massage, and we can treat these clients unless there are severe cases, and that is when massage is contraindicated. If your client suffers from severe anemia, please seek GP approval before treating them. So what does all this information on the cardiovascular system mean for massage? Well, I think the big takeaway here is that old myth of only massaging towards the heart is out the window. Research shows that we do not affect systemic circulation. So if you're massaging away from the heart, don't worry about moving deoxygenated blood back towards organs rather than the heart. You are not having an impact on systemic circulation. You will hear these claims and see them in the industry, but there's no evidence to back them up. Research even shows that massage does not increase blood flow to muscle groups in limbs, for example. Research has shown that peripheral blood flow can increase post-massage. So using heat as an indicator, there can be a heat response. Maybe that has an impact on the blood flow. Other studies show local and superficial increases in blood flow, and that can be demonstrated by the redness or heat that's generated in the areas that you work locally through massage. But this is on a superficial level and doesn't impact the overall circulation of the cardiovascular system. So feel free to massage in any direction that feels good for your client, and be safe in the knowledge that you're not affecting the flow of blood around their body.